When it comes to lower back pain, we often think about how can we strengthen or stretch our lower back to make it go away. Rarely do we think about how do we release this tension in our lower back, which there is a difference from stretching. Hi everyone, my name is Elaine Young. I am a certified yoga therapist bringing you pain care strategies and yoga therapy practices to help you rise above your symptoms, to thrive again and become resilient in spite of chronic pain. Today I have a 25-minute practice for you all about easing lower back tension. And like I said, we rarely think about releasing tension. So this practice is actually really slow-paced, very nourishing practice that focuses a lot on how can we decompress all the gripping and tightening and this clamping down in the lower back region. This is really a crucial first step before we do anything else when you have a chronic lower back pain issue. So for today, what you're going to need is a cushion like this to sit on, a chair, and a comfortable, quiet space where you can spend a little bit of time to take care of yourself and your body. We are going to start lying down with legs up on the chair. So you can just grab any chair you have at home. This is just a dining table chair, but make sure that whatever chair you grab, you can bring the back of your knees all the way against the edges of your chair like so. So you don't want your legs to be off away from the chair like this with your knees kind of hanging up, because as you relax, your legs will actually kind of fall and splay out to the side, as opposed to when you have the back of your knees all the way against the edges of the chair. When you relax your legs will still stay in line in a neutral position, and this way you actually can get a lot more release through the pelvis and through the lower spine. Now, another thing you want to make sure is that if you have a back like this on your chair and the seat of the chair is a little shorter that you can't quite get your feet all the way through, what you can do is turn the chair sideways so that you have this space for your feet to slide through. So give yourself a moment, get that all set up and settled. Now, as you settle into this reclined position, legs on the chair pose, if you find that your head, especially your chin here, tilts up a little higher than your forehead, go ahead and grab a pillow or a small blanket, small pillow, slide that underneath your head so that your chin and your forehead are about level with one another. If your forehead comes up a little higher than your chin, that's completely fine. This actually helps give some traction and length through your neck as well. And what we're trying to aim for is this nice, neutral, flat position for the back, where the floor and back is kind of seamed into each other and back can rest into the earth. Once you have that set up, you can either place your hands over your belly like so, or with your palms facing up and arms by your side. So I'm feeling a little tense in my shoulders today. I'm going to opt for this option, hands on my belly. And if you're feeling tense in your shoulders and upper back today as well, or in general, you can opt for this option. This is a nicer option for tense shoulders and upper back. Elbows rest by your side, and we're going to stay here, start here for a couple of minutes, giving our bodies a moment to settle and rest. Take a deep breath in through your nose. And when you exhale, you can blow the air out through your mouth. In through your nose. And blow the air out. In through your nose. Exhale. Good. And continue like this on your own a few more times. What you're aiming for is with each exhale, it's almost like this facilitator of releasing layers of muscles and tissues from the front of the body towards the back of your body, and from the back of your body down towards your chair and the floor. So like I said, this position creates this neutral position for your back and your spine to rest on. And the next time that you finish your exhale, close your mouth and breathe in and out through your nose. If it feels a little challenging to breathe in and out through your nose, just do the best you can, do what you can. There's blockages, you can definitely breathe in or out through your mouth, but preferably in and out through your nose to activate the rest and digest mode of your body. This is where, in this rest and digest mode, that your muscle tensions start to soften a little bit easier. So just continue breathing with ease, tracking through your head and face, allowing that to soften. Tracking through your neck and shoulders, allowing these areas to soften. Tracking through your arms, hands and fingers, allowing these areas to soften. Tracking through your belly, lower back, chest and upper back, allow all of these areas to soften. Tracking through your hips, thighs, softening. Lower legs, feet and toes, softening. Your whole body just resting down. And there's a moment where there's nowhere you need to go, and therefore your body tension can release its grips. The support from the floor against your back gives a soothing sensation and safe sensation for your whole back. And when your body senses this safety, it actually releases tension more and more. So start to notice if you feel that some of the grippings that are very common along your lower back are softening at this point or ungripping. Go ahead and take another few breaths. And then on your next exhale, you can slide your knees into your chest. Bring them in one at a time. So you pull one in gently and then you bring the other in gently. Hold them side by side. Give yourself a moment here and pause. So the pauses in between movements is also just as essential, if not more essential, than the movement itself. It gives your body a chance to recalibrate, and also for you to observe if there's anything you did just now that might have been really good for your body, or something that might not have been so helpful for your body. This way you can really learn about the patterns of yourself and what works or don't work for you. Give yourself another breath here, and then slowly roll over to one side and press yourself up. You can push the chair out away from the space you have. And then go ahead and lie back down on the floor on your back. Again, you can use a thin pillow or a thin blanket to support your head if you like, especially if there's tension through your neck and shoulders. And then as you lie down, you may collect both of your knees in towards your body. Again, hold them side by side. All right. And use your arms and hands to support your legs at this angle so that you're using minimal effort in your leg muscles and in your hip muscles to keep your legs up. So if I were to let go of my hand, I'm actually using some of my abdominal, lower back, and hip muscle to keep my legs up at this angle. So what we want to do here is to use our hands and arms instead so that the legs can actually kind of lean into my hands here. Okay, so you can feel a little weight of your legs leaning into your hands. That if I let go of my hands, my legs will just kind of get a little floppy. Okay, so let your legs lean and soften. Hips, leg muscles, lower back and belly muscles soften. Keep your elbows close by your side. And now we're going to do a little movement. Again, throughout these movements, use your arms to guide the movement and not so much your leg muscles. So using your arms as you inhale, straighten your arms to guide your knees away. See that I'm still holding on my knees, and there's actually some weight in my hands here and my arms with my legs at this angle. And then exhale, using my arms to guide my knees back in. Okay, inhale, we'll continue the movement. And exhale, knees in. This whole time I'm trying to keep my leg, hip, and lower back muscles free from effort. So they're actually receiving this movement, almost like the back muscles and lower spinal muscles are getting a little massage by this gentle rocking, cradling, massaging sensations. So again, it's the inhales that you're going to bring your knees away, and exhales to draw your knees in. And if your legs don't have this much movement, this much mobility, that's fine. Just do what you can. And as always, all of these you can do while sitting or lying on your bed or couch. It does not have to happen on the floor. Couple more. Inhale, exhale. Inhale and exhale. And then bring both of your feet down onto the floor, one at a time. Rest your arms down by your side, palms facing upwards. Again, the important part here is to pause and observe. Take an easy breath in and an easy breath out. Now you're going to keep your knees bent and feet on the floor with your feet about hip distance apart. Your feet don't have to come tightly close to your hips, but not too far either, like this. So somewhere kind of in between. Now, arms are by your side with your palms facing upwards. As you inhale, you're preparing. And when you exhale, press into your feet to lift your hips just about an inch off the floor. You can almost see that it's barely off the floor here. Just enough that you can slide a hand underneath. So you can see I'm sliding my hand underneath along the floor and just brushing against my hip. So it's just about the width or the height of your hand width, actually. So once you're up here, find your leg muscles now, but see you can release any engagement and contraction through your glutes, through your belly, through your lower back. So your legs are like the anchors of a hammock or the anchors of a bridge, and your hips, lower spine, belly are like the draping of the hammock or the draping of the suspension bridge. We're going to stay here for a few breaths, allowing your belly to soften, glutes to soften, hanging down, spine to soften like suspension bridge. Your legs are the anchor. Take another breath. And as you exhale, roll your back slowly down. So from the uppermost part of your spine that's lifting, imagine or create the sensation as if you're touching one vertebra at a time down onto the floor with your hips and pelvis coming down last. Once you're on the floor, notice how your lower spine feels. For the most part, my lower spine will feel as if it's become a little longer in the way that I even have to adjust my body to accommodate for the elongated space in my lower spine. So this baby bridge pose is actually a nice decompression for the lower spine. I'm going to do a couple more. So again, inhale. And as you exhale, press your feet into the floor. Let your hips lift up just about an inch or so. Soften through the buttocks. your belly and your lower spine. Legs are working for you. Everything from the hips to the part of your spine that is lifted away from the floor. They're hanging like a suspension bridge, hanging like a hammock, free from effort. Breathing easily, naturally. Another breath in. And then on your next exhale, from the uppermost part of your spine that's lifted, you're going to slowly roll your spine down, one vertebra at a time. Or imagine that you are placing one vertebra at a time down with your hips and pelvis coming down last. Again, once you are all the way down to the floor, pause and observe. Once again, my spine feels a little longer, so I'm just making a little adjustment so that my back doesn't feel cramped up. We're going to do that one more time. So again, inhale, prepare. And then exhale, press into your feet to lift your hips just about a hand height or an inch or two. Let your legs do the work as your hips, buttock, belly, lower spine, lower back are all draping down like a hammock or a suspension bridge. Keep your breath easy and natural. Face soft. Another breath in. And as you exhale, you can slowly roll your spine down one vertebra at a time, or create the sensation as if you're rolling down one vertebra at a time. Your pelvis coming down last. Pause and observe. You may again feel that your spine, especially of the lower end, gets a little longer, so adjust as accordingly. Okay, when you feel ready, go ahead and roll over to one side. Press yourself up. So now we're going to take a seated cross-legged position. Now, if sitting cross-legged on the floor, on your bed, or on the couch is not an option for you, you can always do this while sitting on a chair. So I'm going to show you what it looks like sitting on the floor first, and then what it looks like sitting on a chair. On the floor, if you're able to, grab some thick cushions. If this is a yoga bolster, you can grab a thick couch cushion or some thick folded blanket to sit on in a cross-legged position. By elevating yourself, you're actually giving more ease and space for your lower back as well as your hips. And as I come up, you can see that when my legs are crossed, my knees are about the same height as my hips, even a little lower, a little sloping down. Okay, so this is what you try to achieve when you're sitting in a cross-legged position. For this pose that we're going to do next, you're also going to need a yoga block. So go ahead and grab one of those. If you don't have a yoga block, you can grab some stacks of books, a soup can or a jar, tissue paper boxes, anything that it's about that gives you some height here. Okay, now if you are sitting on the chair, you will obviously grab a chair and sit on it, and have another chair or a coffee table nearby, because we're going to lean down here a little bit. Okay, so for example, I have this coffee table here. I'm going to lean into this coffee table. So grab whatever you need where the thing beside you is just a little lower than what you're sitting on. Okay, so that you can lean into it like so. All right. I'm going to demonstrate sitting on the floor, but you can definitely follow along if you are seated on the chair as well. So settle into your comfortable position. You're going to have your yoga block on your left side, and if you're sitting on a chair, you're going to face in the direction so that the coffee table or the second chair is on your left side. Lean into the yoga block or that other object by your side, that other surface by your side, so that as you lean, your shoulder is just approximately over your wrist. If it's slightly behind, that's totally fine. You're going to lean and let your body slouch a little. So the spine is kind of slanting out towards this way. You're not hugging your waist in. You're letting everything kind of drape. So the theme of suspension bridge or the hammock is back again, draping out to the left side. Keep your hip creases, belly and lower back soft. Take your right arm out to shoulder height. Then turn your palm facing up. Inhale. And then as you exhale, reach your arm up towards the ceiling. Take your arm slightly forward like you're slicing in front of the air in front of you. And then take your arm across again. So your arm is kind of in front of your face here. Reach out through your hand and your fingers. Keep your belly and spine soft. So as you reach out, you're now lifting from your waist. Okay, it's your top arm, your right arm that's reaching out to pry some space open through the right side of your rib cage and back. Now, if it feels okay for you, you can let your head hang down towards your left shoulder. Now, if that's too intense for your neck, just keep a little tension along the neck to keep your head elevated. Keep leaning through this bottom arm. It should feel like if you let go of this bottom arm, your body will topple over. Keep your hip creases soft. Soften your belly and spine. Inhale. Exhale. Reach out through your right hand and fingers again. And then to come out, you're going to push yourself up and come back to center. Pause and observe. You may feel one side is a little longer than the other, so we're going to go ahead and switch over, make sure that we're even here. So this is a great stretch in general, just to give a lot of space to the spine. You'll feel it definitely more immediately kind of in the mid-upper spine, but it's also going to give some decompression in the lower spinal area as well. So if you're sitting on the floor, you're just going to move the block over to your right side. If you're sitting on a chair, you can turn the chair so that you can lean into that object you've placed for yourself, whether that's a coffee table or another chair on your right side. Lean into it, make your body kind of loosey-goosey, but your right arm is keeping the support for your body. Belly and lower back is soft, and then take your left arm out to the side. Turn your palm facing upwards. Inhale, and then exhale. Reach your arm up toward the ceiling. Take your left arm forward like you're slicing in front, and then across again. That's in front of your face or so. Belly soft, lower back soft, hip creases soft, and then not gripping. Again, you can let your head drape toward your shoulder if that feels comfortable. If not, just keep a little effort in your neck and keep your head slightly lifted. Inhale. Use your arm. Exhale to reach out. Again, keeping your waist free from effort. The spine is the thing being affected rather than being the mover or instigator of the movement. Another inhale and exhale, reach out. And then to come out, you can bring your arm down and press yourself all the way up. Again, pause, observe, take a breath in, easy breath out. Just notice the way that your back feels now compared to a few moments ago. Do you feel a little longer, taller, more decompressed? Take another breath in. Easy exhale. And when you're ready, you can slowly let your eyes open if you had them closed. Well, thank you so much for watching and practicing with me today. I have a whole library of practices dedicated on lower back pain, so go ahead and check that out and make sure you subscribe to my channel as I come out with weekly videos to help you rise above your symptoms and become resilient. I will see you next time, everyone.